Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, from the recovery room to rehabilitation, we'll meet a woman who made this trip successfully. We'll share winning ways to make moms smile. Then, we'll celebrate a hospital's historic anniversary. Plus, we'll examine how to avoid making a bad back worse. And discover the latest in law and how it could affect you.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. You've made the decision to move to a retirement community, so you have more freedom and independence in your life. But what happens when you suddenly need surgery or joint replacement? Are there advantages to living at the retirement community versus being on your own? David Schell, the Executive Director of Breckenridge Village not-for-profit retirement community in Willoughby, is here to offer some insights. He's joined by Natalie Malm, who lives in a beautiful ranch home on the campus of Breckenridge Village. So welcome to both of you.
Thank you. Thank you.
So David, we're going to start talking to you. Last time you were here, you talked about getting ready for this kind of a surgery, kind of getting a jump start on it. But what can you do to get the help you need after the surgery?
Well, it is such a complex process now, coming out of the hospital and dealing with the myriad of issues on discharge. And then you add the complexities of insurance, which makes it even more difficult. And then, as you know, the changes in reimbursement through Medicare and the changes that are occurring there. So what we offer is a very coordinated and comprehensive way on how we support the resident and the families in that transition.
Okay, well that sounds good. But Natalie,
Yes.
I understand you've been a resident at Breckenridge for the past 6 years.
Yes.
So when you first moved to your independent living ranch home, did you ever envision that you were going to end up in surgery and needing all kinds of help?
Absolutely not. No. I hadn't envisioned that at all. But I did feel a sense of accomplishment, and when we moved in, that Breckenridge had medical facilities that I would possibly need. And my husband and I talked this all over before we moved in, and we felt that it would be the best idea that have the facilities that are needed.
Planning ahead.
That's right. And sadly, 1 month after we moved in, he passed away.
Oh, that's
And
too
after
bad.
he passed away, I had a lot of difficulties in medical problems, and Breckenridge offered exactly what I needed when I get home from the hospital.
Okay, so what do you have to say about the care that was provided to you at the Fairmount Health and Rehabilitation Facility that's, right there at Breckenridge?
Well, I can't say enough about Fairmount staff. They are the greatest. They are caring, loving, they're family-oriented. And when I went in there, I didn't have a care in the world. They took care of everything. All I had to do was to get well. And their staff is wonderful.
That's fantastic to hear.
Yes.
So David, what are some of the benefits of having a comprehensive approach to this kind of surgery like Natalie was able to obtain?
Well, Natalie talks about the quality, and we're so proud of that. But then the support that occurs for the resident when they're being discharged from the hospital. And more importantly, not only for the resident, but for the family member. And then our number one goal is to get the person in the least restrictive and the lowest cost environment as quickly as possible. So there's a whole group of folks that are working to try to make that happen. And it's then residents like Natalie can get on with enjoying life, and that's the most important thing.
Reduce the stress on the patient, reduce the stress on the family. It sounds like a win-win situation for everybody here.
Yes.
Pretty good, we think.
Now, David, for people who don't live maybe at Breckenridge Village, is there still information or help available for those people who want to find out more about this kind of a program?
We have a booklet that's available that talks about the options that are available. And again, that's inpatient short-term rehab. There's also outpatient therapy at our Veal Wellness Center. And you can also have home care through like our Senior Independence. And for residents out in the greater community, they can access that short-term rehab at the Fairmont Health Center and receive the same great care that Natalie received. For our residents, it's even a little bit more bundled because we have the experts there to help support them and walk them through the process. But still a win-win for everyone.
Yes, and I'm happy you're happy there, Natalie.
Yes, I am very happy there. Yes.
If you have surgery or joint replacement in your future, remember you don't have to go it alone. Call the number coming up next and you can receive a free guide to outpatient therapy options at Breckenridge Village. My thanks to David Schell and Natalie Malm for joining us today on the program.
Find out more by calling Breckenridge Village at 440-954-8359 or visit their website www.breckenridgeohio.org. Next, make Mom's Day. But first, this singer-songwriter crooned commercial jingles prior to his jump to star status. Can you name the artist who excelled in musical marketing? We'll make a note of the answer when we return.
For us, the Arctic is almost impossible to inhabit, but for the families that live here, it's home. Warner Brothers Pictures and IMAX invite you to experience a story of love, family, and survival in the harshest place on Earth. To the Arctic, narrated by Meryl Streep with songs by Paul McCartney, rated G.
Now playing at Great Lakes Science Center. Get showtimes at greatscience.com.
Pepsi, Chevrolet, McDonald's, and more were music to Barry Manilow's ears. He sang for his supper to these television advertising tunes prior to making it in music.
A mom's to-do list is never ending. Everyone in the family is on that to take care of list except for mom herself, of course. But in this week before Mother's Day, Dentist Steve Marsh is here to share a few stories about moms who finally took the time to take care of themselves. And surprise, when they were happier, their families smiled more too. So welcome to the show.
Thank you.
Okay, we've got some people to look, but let's start with Laura, who after treatment wrote you a very nice letter. So I'm going to read a segment of that.
Thank you. I'd be glad to hear it again.
I learned something so valuable. Life is better when you can smile without hesitation. Now I'm a brighter, more personable version of myself, and it was your dental and artistic skill that brought this new blessing in my life. So, wow. Tell us about Laura.
Well, actually, Laura was somebody we've had on the show, and she was somebody who has 5 kids and some grandkids, and was the type that took care of everybody but herself. She had some old dental work, and she realized at some point in her life she wanted to do something. And as she had said, she had enough confidence to come to us. There's her before and after. She had some dental work done probably 20 years ago with the beginning of implants. She had lost those front 2 teeth, and we were able to restore her with new implants and some porcelain veneers to give her the smile that she wanted. And I have to tell you, it is so gratifying to see that change in the person when they come through, especially when they've taken care of the kids and the grandkids. Now it's my time. And that may be one of the greatest things about maturing. You know, it's time for us to take care of ourselves.
Yeah, very true, very true. And next we have a mother of the bride.
Well, this was very interesting. Her daughter's actually getting married in June this year. She came to me with these teeth that had, as you can see, very discolored. They were irregular. And the sad part is here she had gone through, nearly 50 years with teeth that looked like that, and was very hesitant to smile, very personable. And again, took care of her family and kids, and now her daughter's getting married and thought, well, it's about time for me. In this case, Lori, we did some gum contouring. Whitening doesn't work on teeth that are tetracycline stained. That's what this.
Oh, is that what the problem was there?
That's what the problem was. She had worn her teeth badly, so we did some gum contouring with a diode laser that's very simple and easy. We reshaped some of the lower teeth, and again, for the wedding pictures, I think this month or so she'll have a beautiful smile to go along with her daughter and her beautiful smile. Her daughter had braces like most of the kids today.
Okay. And then the next patient we're going to talk about was given a little push by a grandchild, I understand.
Yeah, you know, sometimes kids don't have always the barriers that we have, and so the grandchild said to her, "Grandma, your teeth look old, they make you look old." And again, they were worn, and over the years they had discolored, they had turned quite a bit. Now, in this case, we had talked to the grandmother, And she said she wanted them brighter. She wanted them to line up beautifully. She didn't want them excessively white. That's one of the options that people have today. You can sort of pick the shade that you have with the porcelain teeth. And we did porcelain veneers. We gave her what's called the smile line. You can see the edges of her upper teeth go along the lower lip. Again, with 10 porcelain veneers and just a reshaping of the lowers, we got a beautiful smile. And, you know, it's funny, the kids push the grandmother in this case to come to the dentist. So it's sort of a role reversal, if you will.
Yeah, sometimes. And finally, you have a mother-daughter makeover.
Yeah, and this was actually one of our favorite mother-daughter makeovers. This is a woman who actually is head of fashion design at Ursuline College. She came in and had her teeth done, and now her daughter was going to graduate school, and her husband was in the military, and he had actually gone off to Iraq, and she wanted to treat her to something. She had had this wonderful experience, and again, worn her teeth down. So the mother came first, there's the daughter, and there are the two of them side by side with me actually here on the Golden Opportunity set. But that's a wonderful story where in this case the mother was still taking care, in a sense, the daughter, but also wanted to reward her for all her fine work and to help her with her husband going away and such. So a wonderful mother-daughter story in honor of Mother's Day.
All
and
right.
happy Mother's Day to you as well.
Thank you, thank you. So you want to make your mom smile? Give her a smile she can't help but smile about. To find out more, give Steve a call. His number's coming up next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, adding up the benefits of 175 years. Looking for places to go, things to do? Welcome to our community calendar. The Rock and Roll Hall of Fame and Museum has mapped out a unique exhibit, Grateful Dead, The Long Strange Trip. Visitors will discover finished and working manuscripts for classic songs, original artwork that inspired many of the group's album covers, and the band's well-used instruments. You can tour the exhibit through the end of the year. To find out more, call 216-515-8444 or click to www.rockhall.com.
For 175 years, there has been one hospital that has cared not only for the physical well-being of its patients, but also our whole community. Dr. Richard Fradiani is here to share why we're all going to want to celebrate Metro Health's very special anniversary. Dr. Fradiani is Professor Emeritus of Surgery at Case Western Reserve University and the Director of the Burn Center at Metro Health. We are honored to have you here today.
Thank you very much.
So Metro Health is special in several ways, of course, but maybe the most important is this commitment to the community and needs of Cleveland. So tell us about that.
Well, those roots go back to our beginning 175 years ago, where it was the first medical institution in the city. The city hadn't been around very long. The state, came into the Union in 1803. And it was devoted to caring for patients in those days, mostly communicable diseases, because we had no antibiotics, we had no sophisticated therapy.
Yeah, things have
and
come
so
a long
you had
way.
to sequester people that had communicable disease, and that's what we became, as the infirmary for the ill. But the interesting thing is that soon after, or just before we were established as an institution, the medical school was established at what was then Western Reserve University, and there was a cholera epidemic in 1843, and the medical school used those patients to teach the students at the medical school.
Oh.
So our association with the medical school goes back
Way
right back to our very founding principles.
Which is service, really, it sounds like, to the community and to those patients.
Exactly.
So now there's state-of-the-art care, and a lot of that includes providing services that other hospitals don't provide that are in this area. So tell me about some of those services.
Well, we had the polio service in the days before the Salk vaccine, and one of our honorees at the 175th Gala was Dr. Fred Robbins, who won the Nobel Prize in Medicine for his work that led to the development of that vaccine.
Okay.
So that was one of our first. Since then, we've had, well, the burn unit and the trauma center and the helicopter. We've had the high-risk pregnancy unit, the comprehensive care for multiply handicapped children. There's a whole host of special services that we provide to the community because they need to be provided.
Okay, and I know you mentioned before that Case Western and the hospital have a real close connection. Doctors have to teach as well as practice,
all the physicians at Metro Health are on the faculty of the medical school. So we teach the medical students, we teach residents, we teach nursing students, a whole variety of students. But it is an academic medical center in the truest sense of the word, because it has a close tie with the medical school, and we teach a lot of the curriculum at the medical school.
And I know that doctors help not only the area, but have had, the research has impacted the field of medicine like very broadly, like the polio.
Oh yes.
That you talked about earlier.
Indeed.
So.
Indeed. There are stories that I could regale you with in terms of the contributions of the doctors at Metro Health.
So we're getting care from the ones who teach it, which is great. So where do you see Metro Health in the next 175 years?
The absolute most important thing that distinguishes Metro Health is our mission to help people of whatever they need, regardless of their ability to pay. We don't turn anybody away. There's a compassionate care that is rendered to anyone, rich, poor, whatever. And that has always been our tradition, and that is what draws many of the physicians that practice there, is this sense of mission which the hospital embodies. And I think if you were to talk to all of us on the medical staff, that's one of the things we'd say we're the most proud of.
And that's so important, especially these days. So,
Indeed.
On behalf of all of us at Golden Opportunities, we congratulate Metro Health on its 175th anniversary and thank you and them for caring for and about our community. And we wish you and them 175 more years of service to the community. So thank you, Dr. Fradiani, for joining us here today.
My pleasure. Thank you so much. Thank you.
To learn more, call Metro Health at 216-778-7800 or log on to www.metrohealth.org. Next, move it or lose it.
It's time to get up and go. An exercise minute on Golden Opportunities.
Hello, I'm Mike Carbon from Breakout Fitness, and today we're going to do front raises to work our shoulders. All right, we got some dumbbells here. We're ready to go. We're going to start with our feet together. Okay, we're going to keep good posture, so we're going to stand nice and tall, beautiful, with your palms facing your thighs. Hold the dumbbells in your hand and simply raise them straight up to about shoulder height and back down. Once again, this exercise works best when done with slow and controlled movements. Straight up, straight down. How you feel that? Feeling good?
Feeling's all gone.
Okay, all right, everybody. 3 or 4 sets of these, 12 to 15 repetitions would work best. 16-ounce can equals 1 pound of additional weight if you do not have dumbbells at home. All right, everybody, now it's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
A body in motion remains in motion. A body at rest remains at rest. Well, that's not only physics, it's physical. We know we need to keep moving to stay healthy, but what happens when an injury stops us in our tracks? Is movement still the best medicine? Dr. Noel Aboud says yes. Dr. Aboud is with the Solon Spine and Wellness Center. So welcome to the show. So are you telling me, even if it hurts to move, we need to keep moving?
Absolutely. I think motion is so important because motion blocks pain. There's fibers in our when we move that block pain in our brains.
Okay, so by moving, you're telling your brain, this isn't so bad.
Right, because what happens is, in 28 years of practice, I've dealt with chronic back pain patients, and you see patterns, and what I'm seeing is the pain doesn't just affect you, it affects your family, your work, your play. Everyone suffers. But the issue is it's like a downward cycle. You have pain, so you stop moving. You sit on the couch, you gain weight.
Don't your muscles get like atrophy?
Right, and then your metabolism lowers and it slows down, and then the next thing you know, you've gained weight, you're sitting on the couch, your attitude changes, right? And then you might choose to take medicines, or you might choose to self-medicate by taking alcohol or other drugs that are illegal. I see this all the time, and it causes a downward
you're
cycle.
Gaining weight and you're unhappy, and you take the medications, and then you gain weight, and it's just a terrible cycle.
It is.
So we want to break that cycle. But it would seem, though, if you're really, really in pain, that maybe moving isn't such a good idea. Is there a time how you know when that time
And that's what
has
we
come?
help coach our patients with, but just simple things. Even if you can't move, you've got to be moving your feet, your legs, contracting your muscles, because our bodies were created to move. Nothing works well when it's sitting still. In the olden days, they'd have you lay in the hospital bed for weeks. Now, I'm sure at Metro Health, they're telling you, get up. You hear them after a hip surgery, get up and walk. We need you to move, because that's where healing and motion is health. And that's what our technique brings in. That's what we do in our office.
Okay, so when somebody does have some bad back pain that they really do need some help for, you have this treatment for lumbar decompression. But isn't that also just laying there on a table? You're not really moving through it, are you?
But the body is moving for you. The table is creating a pull from head to toe and back in, and it creates this vacuum, and it pulls blood into the disc. So it's exercising for you while you're on the table.
So you're not actually having to move your muscles to do that. It's doing it for you, so
Right,
that
while you're
helps
on the table.
not give you any of that pain.
Because we have to break that cycle. Because if we can get you walking again, we know that then good things start happening. But the first step is get rid of the pain, fix the problem.
And I know you've talked about it before. You are allowing the discs to heal themselves. How long does that treatment take?
It's a half hour on the table, and then we have about 15 minutes of range of motion exercises that we do with you.
Just to get the rest of you moving, huh?
Right, exactly, because you get one part moving. Now those muscles that have been on vacation for so long, we have to strengthen those, get them back in shape.
All right, well, that's all good advice. So we all need to get a move on, but if back pain is stopping you from starting, give Dr. Abood a call. His number is coming up next.
For more information, call the Solon Spine and Wellness Center at 440-248-5070 or click to www.solonbackpain.com. Coming up, the latest in the law and how it could affect you.
Hi, I'm Trapper Jack at Nelson Vein Clinic, where varicose veins just fade away. Barbara is here. How long ago since the procedure?
3 weeks.
What did you notice right away after Nelson
It's
Vein
all
Clinic?
gone.
Pressure was gone?
Oh, it was all, yes.
Pain's gone?
Yes.
And it's covered by insurance.
That is one thing that got me here. That was a big relief. She's very good at what she does. She's terrific. You can hug her like I did.
Isn't it time you took care of your varicose veins? Call or log on to nelsonvein.com.
Did you miss a phone number or website? Then here's your second chance, because we're going to list all of that information again. Then I'll be back to tell you how Uncle Sam will help pay for long-term care. Paying for long-term care is hugely expensive, but Uncle Sam may provide some important help. So, how will our federal government help pay for long-term care? There really is a way, and it's through tax relief. I know we've talked on the show before about taking an income tax deduction for nursing home costs. Unfortunately, many people still don't understand that in most cases, the full amount of nursing home costs can be deducted as medical expenses on your federal income tax return. But there's more. Here's a big break that very few people use. Payments to caregivers of a person with dementia are deductible medical expenses, even though the caregivers are not licensed healthcare providers. So, you can hire a person with no degree, none at all, to come in and watch your parent, maybe help her dress and bathe, and you can deduct those payments as medical costs. The United States Tax Court just confirmed that rule last year. What's the best way to get this benefit? Even if you don't have a high income, you might be able to get a major benefit by spending your IRA and 401k funds before other regular savings and investments. Normally, when you take money out of the IRA, you have to pay income tax on those withdrawals. But if you are spending the money on caregivers, you may use the deduction to eliminate the income taxes either partially or maybe even completely. And it's a good idea to pay everyone in a way you can document, which means don't pay in cash. There are lots of reasons not to make unreported cash payments, and one of them is that if you can't document the payments, you won't get the deduction. Checks are okay, but cash is not. Are you paying someone to help care for a spouse or a parent with dementia? You know that it can be quite expensive. But Uncle Sam can help by offering a tax deduction. So be sure you take it. We'll be right back.
Call Budish, Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.budishandsolomon.com.
Next week, we'll tell you to take a walk for your health. We'll help you step out on the right foot. Should annuities be in your retirement planning toolbox? We'll nail down the answer. We'll celebrate Mother's Day in fashion with fabulous and frugal finds for Mom. And we'll wish a happy anniversary to a Cleveland institution that has been helping seniors for 130 years. So until next week, please remember to make the most of your golden opportunities.
Would you like to join our kitchen conversation? All you have to do is call toll-free 1-877-765-1543 and leave us your question, name, and phone number. Or log on to www.golden.tv for all the latest information and show updates.